Hello, I'm Katie. I'm super excited that you're joining for today's video where we have the great pleasure of filming together with our TCM therapist, Mounia, who has her own TCM practice, and you can also reach her online. We will link that in the description box below, so feel free to reach out if you have any additional questions. Mounia, I'll let you introduce yourself.
Thank you for having me here. I'm Mounia, as Katie said. I'm a TCM practitioner. I have my practice here in Zurich, and I combine the principles of TCM with modern insights of the medicine, of the conventional medicine, to support women in every phases of their life, from regulating stress, hormonal shifts, pregnancy, support them on their fertility journey, digestive issues, and I love to combine the principles really with easy to adapt advices, nutritional advices, so that they can have a better understanding of their own body and adapt them, the advices, in their life.
And that is exactly why I'm talking to Mounia, because Mounia specializes in women's health. So it's TCM around women. And today we are going to be talking about pregnancy nausea and what TCM has to say about nausea from medical and a traditional Chinese medicine perspective. So Mounia, if you could tell us, what is pregnancy nausea? Why do some women have it? And where it comes from.
Yes, it's a big field, so I tried to keep it short and simple. So pregnancy nausea or pregnancy sickness and vomiting is very common, and I think 70 to 80% of pregnant women have these symptoms, and it is triggered from different hormones. It's very technical, but in fact it's a rising human chorionic gonadotropin. It's a hormone, and it's very active in the early pregnancy. And then we have also a GDF-15, and it's also interacting with this HCG. Both are produced in the placenta and could really trigger this nausea and sometimes also vomiting. So when does it start? So normally it starts from the 4th, 5th week, then we have a peak around 9 to 11, and then it resolves from the week 14 to 16. But however, there are women, 10% I think, who can really experience this nausea and vomiting until the end of their pregnancy. So yes, but there's another thing. So some other women, I think 0.5 to 2%, can experience a really severe form of this nausea and sickness and sometimes vomiting, and this is called Hyperemesis gravidarum. So this is a severe form where you vomit very much. You can have a weight loss up, 5% of your pregnancy weight and plus, and you have really difficulties to keep your nutrition, your food, and the fluids in your body.
And Mounia, this is something that you were dealing with in your pregnancy, right?
Yes, I know this very, very much. Because my experience was really a personal one with this topic. I experienced Hyperemesis gravidarum. It came in the 5th week of my pregnancy, and I had really struggled to keep food inside of me. It was very challenging because when I went to the doctor, they gave me advices, they gave me medication, they sent me to the hospital because I lost, I think, 5 to 6 kilo in the early months, and they gave me IV fluids because of dehydration. I had always dry mouth and dark urine, but nothing worked really for me. It was very, very exhaustive time, and I was feeling a bit alone because nothing seemed really to help. And you're searching for some other solutions, and that's why I found the TCM for me. At the time, I heard of a midwife who was treating pregnant women who suffered from hyperemesis or pregnancy nausea, and she did at that time treatments in my apartment, because at that time I couldn't go out, I couldn't do any grocery, because if I got out I had to take some emergency bags with me because I threw up all the time. She treated me at my home, and after the first treatments already I felt a shift. I could get up, the vomiting stopped for hours, and with each treatment I saw something is changing. I could do more in the daytime, I got to work again, and that was really a moment that marked me and motivated me to study TCM later and to help or support women, especially in these challenging times when there are hormonal shifts.
Thank you for sharing your story with us. So this is the reason why we're talking to Mounia today, and why she became a TCM therapist and is helping other women with this topic among other topics as well, currently in her practice. I find it very interesting that a lot of women experience this pregnancy nausea. It's not very common to talk about it openly. And I belong to many groups of mums and women, and sometimes this question does come up, that they are 15, 20, 25 weeks pregnant and they still feel pregnancy nausea. Would it be advisable for such a woman to seek help from a TCM perspective? Or, because you mentioned that it is normal for nausea to start around 4 or 5 weeks in pregnancy, and for some it's more severe and for others less. So in my specific case, I did have a heightened sense of smell, and things irritated me, for example cooking dinner, or I couldn't eat certain foods, but it was never extreme. However, it looks like there are quite some women out there who have it a lot more extreme, just like you, with more vomiting and being even more sensitive, and that it doesn't stop for them. So my question to you would be, would a woman, at which point in time would such a woman with nausea, experiencing this morning sickness, which can be at any point in the day, right? Yes. It's called morning sickness, but it can be in the morning, it can be at any point in time. I personally felt more sick in the evening, actually, rather than the morning. But at which point in time should a woman seek help from a TCM perspective?
There are many categories. If someone already experienced some morning sickness or nausea in a previous pregnancy, so it's a good thing to keep that in mind, maybe for the actual pregnancy, to come back to support this. But maybe you can have the same experiences again. So we always keep that in mind for women for another pregnancy. Seek help very early, don't wait until it's very unbearable. Then if you have in the family or around you people who have morning sickness or something like this, and you experience some kind of anxiety or stress, then it would be also a moment to seek help. And in the specific case of Hyperemesis gravidarum, when it's really severe, when you can't deal with daily activities, if you throw up every hour and you can't do anything because you're exhausted, you lost weight, you are dehydrated, then really don't wait, go to a therapist who can support you with acupuncture, with mycotherapy, nutritional advice, with some relaxation exercises like qigong or breath exercises. All these kind of things have to be done very early. And yeah, don't play this down, though, oh, it will be okay, and all the women could throw up, and nausea is normal. No, it's not normal if you can't work, and you throw up, and you feeling alone and exhausted.
That was a bit of my question. What is normal? So normal would be feeling a little bit sick, but...
Yeah, normal is really, it's depending from every person. So normal, I hate normal, but it's a common experiences are when in the daytime you have the whole day some moments when you feel it comes up, nausea, you feel your thorax area is a bit tense, you're feeling hot flushes when you think or something is coming up. But you can always eat in the daytime. You can have small meals. You can drink. You take on weight. You don't lose weight because you're throwing up. If you throw up and you lose weight and you dehydrate and you see that your urine is dark and you're exhausted, then it's not normal. So there are two things, you know?
Yes, I agree. There's nothing normal in pregnancy. There are common symptoms and there are less common symptoms, but there's nothing normal about pregnancy.
Yeah.
So would it make sense for somebody, let's say they're pregnant with their first baby, it's their first pregnancy, would it make sense if they, before starting to experience anything, to seek advice from a TCM practitioner like yourself?
In general, during the pregnancies, the TCM practitioner are very happy when the pregnant women come in the 3rd month, in the 6th month, in the 9th month, and then come for birth preparation. So it's always a good moment around the 3rd month to come to acupuncture or TCM to support these kind of things. And if you have the slighted feeling or the experiences that there's something wrong and you're not feeling all right, then come immediately.
So Mounia, can you tell us what does traditional Chinese medicine actually do to help with nausea and morning sickness?
Everybody knows acupuncture with needles. Maybe some people don't know ear acupuncture. You can needle specific zones on the ear, but you can also put ear seeds, which I like during pregnancy to do that, because it can, especially for morning sickness or vomiting or hyperemesis, gravidarum, can really relieve the symptoms.
Sorry, what are ear seeds?
Yes, I will explain.
Okay.
These are really little seeds, really seeds in terms of from the plant, from the Vacaria plant. It's a little tiny seed on a patch. And you take this patch, it doesn't hurt at all, you put this on specific areas to support the women. Because you have to think, our ear is a small cartography of our body in TCM. So if you want to work on specific things, you can go to the ear and work it. So I will always use the ear seeds to support women. Sometimes I do, sometimes also cupping and tweener. And tweener is our massage technique that can really calm also the nervous system. We can also do some qigong exercises. So we will always combine different methods and always include nutritional advices, because these kind of things are the methods we work with.
So you mentioned that a pregnant woman, it would be most advisable if she comes to a practitioner, a TCM practitioner, in the 3rd, 6th and 9 months in pregnancy. Let's assume that this woman is experiencing very bad nausea. She starts coming to you. How long would a treatment, or could a treatment look like? Of course, again, every case is different. But if you could take one example and kind of lead us through the process just to know what an expectation is. Is it multiple acupuncture sessions? Is it, do you give those seeds for the person to put by themselves in their ears? You mentioned Qigong as well. Maybe you could tell us a bit about that.
Yes. So at the beginning, I have to do a big questionnaire the first time to really know the person. And when did it start? How was the development? And what can trigger this? And when I have my TCM diagnosis with all this information, the medical history background, the pulse, we are also fulfilling the pulse in TCM, looking at the tongue, and all these kind of information are little tiny puzzles who gives us a bigger picture. Also some information about life situation, work situation, family situation, all these kind of things are very helpful. And then at the beginning, if there's some women who experience the nausea very bad and very strong, it could be that we see at the beginning, or maybe twice a week, you know, or more. And if it's a soft nausea, you know, we can see once a week. And then we see from treatment to treatment, how is the progress, how is she feeling, what can we adapt from the nutrition, and then we will go step by step. And then sometimes after some sessions, 5-6 sessions, it's already good. Some others need maybe more sessions because it's there are more frequent periods of nausea and vomiting, and maybe there's also weight loss, and so we have to work a bit more.
And could you explain Qigong
Yes.
as well?
It's also one of our disciplines in TCM we work with. Qigong, you have to imagine Qigong like a movement practice. Maybe you saw some elder people in parks doing slow movement in the air and moving slowly. That is a practice we integrate, because with the movement, with the breathing, with some kinds of positions, we can activate the flow of qi, the life energy we work with, and the blood in our body. And there are specific exercises for everything. For opening the chest and giving more space because we are feeling tense, to calming the nervous system, to working on lung or the belly area. There are so many different exercises, and we can always give some exercises the women to do at home. Especially when you're feeling tense or nausea is coming up and you're exhausted, you can every time pick one exercise to do it at home or in the park, or I don't know, you can do all the little exercising a breathing exercise in the tram. You know, you're in the train and breathe with your headphones.
Would you be able to show us some exercises, maybe for another video?
Yes, with pleasure.
Perfect. Then we'll do another video with some specific Qigong exercises that a pregnant person can do either at home or on the go, or when they feel some tension rising in them. Fantastic. I have another question about kind of lifestyle and nutrition, because from what I understand, TCM is a holistic approach and looks at many different areas of a person's life, and of course nutrition is a very big part of every person's life. What are some tips around nutrition from a TCM perspective when it comes to nausea?
Yeah, you said it. TCM is very holistic medicine, and we look always about the connection between body, mind, emotion, environment, seasons. We have the 5 elements, and every element is also a season. So we look specific at nutrition also in kind of each season and each person and what kind of constitution you have. So and in the case of pregnant women who experience maybe nausea or vomiting, we look very specific into their nutrition, and we recommend really to take off from their plans cold raw meals, because the digestive system, our middle jaw, is stomach and the spleen, and this is very the fundament, you know. And if you give them cold raw meals, they can't extract what we need for the body. It has to be really warm. Then we take very much attention on not so greasy food, not so much sweets, taking small portions but frequently in the day, suggesting like some porridge, some rice congee. It's a rice soup in TCM, which is very good to digest. We will recommend some teas or some herbal teas, or we will recommend mycotherapy, medicinal mushrooms to support them during pregnancy, because they're safe during pregnancy. You don't have to be panicking about this. And also we want also to look at the time when they get their meals. It's also important not to be too late, but not too early for the overnight fasting, because sometimes when the period is too long during the day, the blood sugar fluctuation can create again some nausea and sickness. So all these kind of things we suggest also to drinking broth. It's a kind of old school thing, but the TCM therapists love broth. Vegan broth or vegetarian broth, or with kind of meat, you know, with the bones. And you can drink it like a cup of broth during the day to have something nutritional.
Mounia, is there something else that we didn't yet mention when it comes to pregnancy nausea and the TCM perspective around pregnancy nausea?
There were some new researches 2 years ago about the GDF-15 hormone. And it's very important for me, because all the years I heard, okay, nobody knows really how to help these women. Take some medication against the vomiting, do some IV fluid injection. But I'm really happy that in the last 2 years there were more research about this hormone, with triggering really this Hyperemesis gravidarum. It's the GDF-15 hormone, and it's a kind of hormone like the HCG hormone produced by the placenta. But the GDF-15 triggers a really specific area in the brain. It's the area postrum, it's in the lower brainstem, and this kind of area is triggered especially and causes the excessive vomiting and the sickness and the nausea. And I find it very helpful that these researches are done now, because now we know it's existing. We can do some research, we can help the woman, and don't downplay this kind of things. And there's research for medication to block this receptor in the brain, and I think it could help so many women out there. That research is done now, and that was really an important thing I wanted to share, because I'm happy that it's out now, that we know what's happening, and it's in the brain, and it triggers so many things, like the sensitivity of odor and smell, you know. So maybe things were changing now, and we get more help, and we can combine these kind of things together with the conventional medicine and support women with the TCM.
So Mounia, thank you so much for giving us some insights about nausea, how TCM treats it, or what can be done from a TCM perspective to help treat morning sickness and pregnancy nausea. For everybody who wants to meet Mounia, we will link in the description box below. We will provide Mounia's details, so you can reach out if you have more questions, or if you would like to seek a consultation or help from Mounia. And we will also make some other videos with some acupressure points, as well as the Qigong exercises that we mentioned. And with that, we're going to finalize this video. So Mounia, thank you so much for joining today and for sharing your expertise around the topic.
It was a pleasure for me.
And we hope to see you in a few next videos in the future.
I hope to. Thank you.
Perfect. Thank you so much.
Thank you.
Bye.
Bye.